Good afternoon, everyone, and welcome to today's webinar on domestic violence and the impact of COVID-19 on a marginalized population. I am Jemima St. Louis. I am a professor, an associate professor in the clinical psychology department at William James College and the co-director of the Center for Multicultural and Global Mental Health, also located at the college, which is in Newton, Massachusetts. This webinar is being offered in partnership with two of our colleagues who represent Dove Inc. and the Asian Task Force Against Domestic Violence, both of which are based in Massachusetts. During the current pandemic, one of the priorities of the Multicultural Center has been to ensure that we provide a platform to bring together concerned citizens in order to raise greater awareness about the unmet needs of underserved communities, identify and share resources, and continue to advocate for services that can address the health and well-being of historically marginalized individuals, families, communities, locally, nationally, and across the globe. We are pleased to welcome two of our colleagues today who will lead the presentation. But before I introduce them, I would like to go over some basic housekeeping items. Please note that in order to minimize any background noise and interference, we have muted all participants, but we will unmute and allow participants to ask questions toward the end. Copies of the PowerPoint presentations will be emailed to all registered attendees. Please feel free to use the chat box to raise any questions or to share any comments that you may have during the course of the presentation. And if you feel comfortable, we would like to invite you to share your name, the organization that you represent, and the city, town, state, or country from which you are calling. We would love to hear from you, and you can use the chat box to do so. Now, I'm going to introduce our two speakers. The first presenter is Ms. Muling Cai, who was born and raised in mainland China. After graduating from Boston College School of Social Work as an international student, she has worked at Dove Inc. as the Chinese Advocacy and Outreach Coordinator. At Dove, she works directly with domestic violence survivors, providing culturally and linguistically specific supportive counseling and advocacy services, as well as trauma-informed care through Dove's community office. She also provides outreach and targeted education to Chinese and Chinese American community in Dove's catchment area in order to raise awareness about issues of partner violence. The second presenter is Ms. Dawn Sauma, who is the co-executive director and clinical director of the Asian Task Force Against Domestic Violence, otherwise known as ATASK. She has worked at ATASK for over 9 years and in social services for 28 years as a provider, educator, manager, and administrator within mental health, crisis intervention, judicial, academic, and nonprofit systems. The majority of her work has focused on underserved Asian communities in various settings and service delivery systems, both in Hawaii and in Massachusetts. It gives me great pleasure to introduce our speakers, Ms. Muling Cai, who will be followed by Ms. Dawn Sauma. You ready, Muling?
Hi everyone, my name is Muling. I'm a Chinese Advocacy and Outreach Coordinator. And I work for Dove. We are a very pretty typical and general domestic violence based out of Quincy, Massachusetts, and serving mostly the South Shore area. So I'm very excited to be with you all today and share some of our experience with DV or partner abuse. The first part, I will be given sort of an overview of DV, including some DV concepts and services and some tips for how to support someone. So the first slide that I'm gonna show you here is the map of the state. which shows all the services that are available to people that live in Massachusetts. It's from Jen Doe, the Massachusetts Coalition Against Sexual Assault and Domestic Violence. It's a very important source of information, and I highly recommend checking out their websites. So this is DV and sexual assault services combined. Some of these organizations have shelter and a community service office. Sometimes organizations just have one or the other. But the best way to find out which organization will serve the person you're working with is to go to Jen Doe's website. So if you look in the bottom left of this slide, you will see their website. So if you go to their website, click on Find Help, you can put the person's zip code and it'll let you know which organization is closest to them. Okay, so what does a DV agency do? I'm going to use Dove as an example. As mentioned, we're a pretty typical domestic violence agency. So I'm going to talk a little bit about our shelter and then about our community service office, hopefully to shed some light for folks who don't work in the field. So Dove has been around for just over 40 years now. We do offer a shelter program to people that are looking to escape an abusive situation. Our shelter is small, which is pretty typical of all the DV shelters across the state. We have 6 bedrooms, so we can house up to 6 families or 6 individuals at a time. So out of the shelter, we have support groups, try to have social events for folks that might be a way to build community and get to know one another, decrease their isolation, and each adult in the program has their own advocate. So that advocate meets with them on a weekly, if not more basis, working on goal setting, applying for housing, getting people connected to resources in the community, providing a lot of emotional support, safety planning, risk assessment, and figuring out what it is that brought them into the program and how can we keep you safe while you are here and create a safety plan for you to move forward. So out of the shelter, we also run a 24/7 hotline. So that's a great resource for folks who might not be ready or not safe for them to come and talk to an advocate in person. So these are the services that we offer at our shelter. What I often talk about is how DV shelter space is really difficult to find in the state. Most DV shelters are full 100% of the time. There's a lot of larger reasons for that. The cost of living in the area makes it really difficult for people to become financially independent. There's not a lot of funding for transitional programming, and so the long housing list for state and federal housing really back everyone up to keep folks in the shelter for a really long time. So as you can imagine, that kind of low turnover rate all across the state can make it really hard for there to be available openings for people. So unfortunately, often means that people can't leave a situation that they're stuck in. We will also work with folks on the phone to talk about ways they can try to stay safe at home, try to help them come up with options of staying with families and friends. Still, in reality, it really means that folks that want to leave and go into shelter often are not able to, and it is something that we are all very well aware of. It's just important for you to know as providers that just because someone wants to leave a relationship doesn't necessarily mean that they're going to immediately be able to find shelter space, and we want to set realistic expectations for the people that we work with. So next, I'm going to talk about resource that's much more regularly available to folks, and that's the services we provide out of our community service office. Sometimes people want to know, what if I haven't experienced physical abuse, or what if I'm not looking to leave my abusive partner? There really aren't any requirements to come in and receive services, except that you've experienced abuse and want to talk to somebody about it. So we have support groups that meet in the day and evening, individual counseling and advocacy, both for children and for adults. So when we work with adults, we're doing safety planning. We're sitting with folks for a long time and asking lots of questions about what's been going on in their past. What are behaviors that their abusive partner has exhibited to them to get more control, and all these things help us to assess someone's risk and then to develop a safety plan. So we're providing lots of emotional support to folks and then try to connect them with resources in the area. So we have a really extensive legal advocacy program, a court outreach program where they are stationed at both districts in Norfolk Probate Court on a monthly basis. We have advocates that are at the Quincy District Court on Fridays for a restraining order day to provide support. To provide support, we're also able to offer limited representation around divorce, custody, and child support, often help people fill out paperwork, learn how to represent themselves, connecting people to low bono and pro bono attorneys in the area. We're almost always able to provide restraining order representation for folks at the area courts. So we also have a very extensive civilian domestic violence program. And so this program is staffed by folks that work for Dove, but cover all 8 of the police stations. So you can see the list here below. These advocates go out to these police stations, work with police officers to get them trained to give best response when they are responding to a domestic violence call. They're also following up with anyone in any of these towns that has called the police for domestic violence. We also separate from all of our responsive services, have a prevention department. This department does a lot of school-based presentations. Some of those are peer-led with our program called You Speak at both middle and high schools. And we do a lot of trainings and workshops to providers and community members that want to learn more about DV and some of the services that are available. So there are variances and different capacities depending on specific programs, but this is to give you all an idea of what a DV program might be doing. So according to Jane Doe, sexual assault and domestic violence programs continue to operate and are available to provide confidential support during COVID-19. For example, like for Dove, all of our in-person meetings went virtual. For community and legal, we meet with people on Zoom or on the phone and doing our best to figure out the shelter situation while following all the CDC and state guidelines. So next, I'm gonna talk a little bit about how we define domestic violence, which informs our screening process or assessment. So essentially, what we're really looking for is a pattern of power and control. Sometimes folks are still looking, asking us, if I've never experienced physical abuse, can I still come for services at Dove? We know that abusive relationships can be really scary and really controlling and really isolating without there ever having been any physical or sexual abuse happening. So we know without intervention, the abuse usually escalates in frequency and severity. So encouraging the folks that you're working with to be connected to a domestic violence agency or reaching out when they're ready can be a great place for someone to increase their independence, the knowledge, and get help making a plan to stay safe. Okay, so this is a term at the relationship spectrum that we use to kind of explain in a very simplistic way different types of relationships. So if you can imagine relationships existing on a large spectrum, on one end you have healthy relationships that are based on equality, respect, and trust. It feels supportive and peaceful. There certainly are disagreements, some small ups and downs, but both people take responsibility for their missteps. When we think about an unhealthy relationship, you think about aspects that might include selfishness, a lot of arguing, dishonesty. There might be a lot of stress associated with that. Some people talk about it being toxic, dramatic. It can feel really frustrating and hurtful. But for the most part, there isn't a dynamic where one person is trying to control the other. So as soon as we see any aspects of control coming into the picture, that's when we start to think about the relationship being in this last category, the abusive category. And so that's really all based on the pattern of power and control. It can feel scary and overwhelming and isolating, really, really confusing, and people have control. You may also have really great times with your partner when the relationship feels really healthy. So that's really confusing. But as soon as we start to see any pattern of one person having control over the other, that's when we get concerns that that relationship isn't just unhealthy, but in fact might be in that last abusive category. And we know that abuse doesn't just go away. Okay. So some of the terminology that you might hear to refer to both to the issue itself and to the people that are involved, you can say below. So we most commonly use the term abuser to refer to the person that is exhibiting this abusive actions. Sometimes you will hear people refer to that person as perpetrator or batterer. We most often use the term domestic violence or partner abuse to describe the work that we're doing in the medical field. Often you will hear people use the term IPV or intimate partner violence, dating violence, abusive relationships, all refer to the same issue. And then most often we use the term survivor to refer to the person that has experienced abuse. We really look to the person that we're working with to see how they want to be identified. Sometimes people choose the word victim. They feel like that's what happened to me. I was victimized by this person and identified with that term. So the term that no longer really widely in use is battered women. It's sort of a narrow definition of what we know domestic violence and partner abuse to be, in that it affects more than just women, and it includes more than just physical abuse. So a couple of statistics that I wanted to share. An important statistic directly coming from Massachusetts is that nearly 1 in 3 Massachusetts women has experienced rape, physical violence, or stalking by an intimate partner. So kind of giving you an idea of how unfortunately common this issue is, and how right in Massachusetts 1 in 3 women are affected by this. Every year, every state reports to the national census on how often domestic violence is happening. So they take sort of a snapshot of one day across the country of what happened. And this statistic is from 2014, but they found that on this one day, over 1,700 victims were served by Massachusetts domestic violence programs. And so that statistic has remained pretty much around the same prevalence in the last couple of years, but kind of shows in that one day in just our state how many people are reaching out and trying to get support. So most of this were requests for housing, for shelter, and the rest include folks that are looking for counseling and support groups and attorneys. So these are some statistics that reflect domestic violence across the US. Very similar as what we see in Massachusetts. Here, I just want to highlight the presence of a gun in the home during a domestic violence incident increases the risk of homicide by at least 500%. So just important to note that just having a weapon in the home really increases the risk of someone that you might be working with by a great deal. Okay. So I think we've all heard about as the current public health crisis goes on and the government adopts a dedicated measures to slow the spread, it's less ideal for DV survivors. And there's been increased reports and incidents of DV during this period. So why the rise, why the correlation exists? Studies have revealed how natural disasters and crises such as Hurricane Harvey, for example, affected families that had already experienced domestic violence, and found the stress associated with the disaster led to higher rates of both DV and child abuse during and after the hurricane. So according to research, it could be a couple of things. For example, isolation, which is advised or sanctioned by the government to help stop the spread, but it's one of the most common tactics employed by abusers of domestic violence. It can lead to the normalization of abuse and allow abusive tactics such as gaslighting to become more readily available and effective, and cause survivors to rely more on their abusers in different ways that eventually makes it harder to escape. And stress, especially during a viral pandemic that's ongoing and there are so many uncertainties, elevation in stress hormones has been associated with increased aggression and a rise in intimate partner violence. So other risk factors, unemployment, economic anxiety, alcohol use, lack of resources at courts and social services, under-resourced shelter space and emergency rooms, and people don't want to go out in public and risk getting the virus. So no longer available safety plans that people often rely on. And we can see these things happen every day, and those factors at play more or less. So, and also as we are speaking now, the reports of increasing rates of DV are beginning to surface in the States and around the world. In the US, agencies from across the country are reporting an increase in DV and abusers using COVID-19 as a weapon against their partners. So in China, DV is reported to have tripled during the shelter-in-place mandate. France has indicated a 30% increase in DV reports. Brazil has an estimated increase of 40 to 50%, and similar situation in Italy and Spain reports a horrific DV-related homicide trend. And specifically, estimates from the UN suggest that every 3 months of quarantine will result in a 20% rise in IPV throughout the world. So that's very, very concerning data. And I wanted to also go through real quick some of the different types of abuse. The reason that we talk about this, again, because people often associate domestic violence with just physical abuse, often miss some of the tactics that abusive people use that fall into some of these other categories. I'm gonna talk a little bit starting with physical and sexual abuse, and then moving to some of these other less understood types of abuse. So below is a list of some of those tactics of physical abuse. Except for the commonly known ones, one of the most high-risk forms of physical abuse is choking or strangulation. We know the legal definition of what's happening if someone is putting any kind of force around your neck to restrict your breathing or blood flow is strangulation. It's a very considered high-risk factor and unfortunately present in a lot of homicides that happen in our state and across the country. So we know that if we're working with someone that has experienced that in the past, there's a really high chance that's going to happen again and really increase someone's risk level and our concern for their safety. We also see a few things that don't include physically putting your hands on someone, that might be throwing objects across the room to scare the person, punching a wall or preventing somebody from leaving the room. Anytime someone's using any kind of physical force to intimidate their partner, the real kind of intention behind that is to get more control. And so we're really looking for is the intent behind that action, not just the action itself. So does the intention behind the action add more control to the abusive person? If so, it's most likely that that action is abusive. So sexual abuse, sometimes abusive partners are very manipulative around forcing their partners to do things that they're not comfortable with. Sometimes using marriage or faith as a way to kind of rationalize that. Lots of accusations and guilt tripping their partners into something they're not comfortable with. And so again, trying to broaden this definition a bit beyond just what might think of as physical force, also thinking about reproductive control, not being allowed to take birth control, have that sabotaged, not having choices about keeping or terminating pregnancies, and restricted access to medical care as well as a way to kind of establish more control in that relationship. So financial abuse is probably one of the last thought of types of abuse in a domestic violence relationship. For many clients that we work with who know that their relationship is abusive and want to leave, financial abuse is often the reason that they're not able to do that. If their abusive partner has intentionally set up finances that their partner doesn't have access to it or doesn't know how to access it, maybe they've prevented them from working and getting their own money or their own work history, maybe prevented them from finishing school, often under generous pretenses like, I don't want you to have to worry about anything, I'm gonna take care of all the bills and all the finances. All of these offers that maybe initially seemed thoughtful and kind really had an intention behind them of getting control. So if you haven't worked in a long time, if you don't have access to resources and income, your partner maybe has run out charges in your name and ruined your credits. Trying to think about starting all over on your own is already incredibly overwhelming, never mind with such a huge financial setback. So we're often talking about how effective this type of abuse can be in controlling someone, and to people early on in relationships before it's being established as unhealthy, to be kind of thinking about how they can maintain their own financial independence. So emotional and verbal abuse is probably the most pervasive type of abuse that we see. It's often the first way to try to establish control in a relationship. It's sort of a myth that survivors of domestic violence have low self-esteem at the start of a relationship. But that's usually something that's happened after a lot of really intentional practices by an abusive person. So if you can get someone and cultural abuse, and trying to leave some time for, a discussion on what to do to help someone, either for professionals or anyone, because technically we could all have someone that we know that's experiencing this. So just a reminder of what might have been the barriers for someone to leave an abusive relationship. The reason we not only want professionals to know where to refer to people and practice trauma-informed care, but also wanted to increase awareness among general public is really because people reach out to their families and friends first. And so wanted to share this. Okay, so informed by our empowerment model, there's a couple of things that we wanted to share about how to raise concerns and show support. So some practical tips for how to support someone and respond to a disclosure in an empathic way. What you can do, for example, believe the victim or survivor, use an approach that does not blame or judge someone's abusive history, express regret that someone has been mistreated, and let them know of a safe safe place and time to continue sharing if desired. Remember, the person knows the dynamics of their relationship best. So try not to pressure someone into leaving or what to do, and do not apply your own timetable. And because people, they all pace themselves. So instead of saying you should leave, did you try to stop the abuse? Just say things like, it's not your fault, you don't deserve the abuse, I'm concerned for your safety and I'm here to support you. I don't know the answer, but how can I help? So additionally, you can ask open-ended questions to understand what they are going through, providing validation, express that you are glad that they are able to share. Also, you can share what you've noticed, share knowledge that abuse generally escalates, and ask questions about their own concerns and safety. Remind that there's no excuse for abusive behaviors, not drug or alcohol, not adversities in childhood. Be aware of the impacts of abuse can be psychological and emotional, and ask the person what they need. So you don't need to know exactly what would be helpful, but more importantly, show that you're a supportive resource, finding different ways to empower them with your support. And lastly, be patient. We know that on average, it takes 7 attempts to leave an abusive relationship. And so exiting the relationship is the most unsafe time for a victim. So the timeline surely looks different for each person. So more specifically, ways for us to offer support can be getting to know what's available in your community. Between you and the person, you could offer help crafting a safety plan, brainstorming ways to connect with others, increase independence, thinking about action steps during an emergency and the logistics of it. And especially now amid COVID-19, can you establish safe times to check in over phone, text, video chat, or email with someone, and being creative in staying in touch? Can you play games online or have a virtual date with your kids? And things like that. So for yourself, deciding what you feel comfortable or able to provide, we often emphasize the importance of self-care, and that extends to everyone who is trying to help. So know that offering support can feel great and it's so important, but can take a toll on you. So that's why you should only offer what you can. You don't have to be the only one, and you can, it's okay to ask someone whether it's okay to bring trusted people or DV agency to help build the support. So this may be a very frightening and isolating time for survivors and their children. It's a good time to activate friends and family and community support. So I'm also attaching a friends and family guide from a future without violence for folks who wanted a further read. Yeah, so that's all I have for you today, and thanks for listening to it. And now we can transition to my colleague Dawn's presentation.
My name is Dawn, she, hers, and I'm from the Asian Task Force Against Domestic Violence. And today I have one goal, and that is for participants to leave with a few new insights into the Asian population. And I hope to do that through a couple of objectives. And that is, first, to share the narrative, shift the narrative on disparity in Asian populations, to identify barriers faced by LEP Asian victims of violence, to share our approach to bridging barriers, and to highlight the impact of COVID-19 on Asian victims of violence, and not particularly in this order. And I'm going to find that some of these objectives are going to overlap in our conversation today. ATASK is a grassroots social justice organization that was formed in 1992, and like other culturally specific organizations, it was created to counterbalance inequities. 28 years later, we remain the only culturally specific and linguistically specific organization serving Asian victims of violence in the state of Massachusetts. ATASK fills a critical gap in public and social service systems, bridging linguistic and cultural barriers. In addition to programs and services, we also are advocates for change. To start, there are a few underlying assumptions of the Asian population that perpetuate ongoing systemic barriers. One of these assumptions is the model minority myth, which assumes that Asians as a racial minority group have achieved a higher degree of socioeconomic success, which is done by using data comparing averages of economic levels, median family income, and marital status, and other aggregated data between Asian Americans and other races. However, this methodology is inaccurate and creates a false sense of perception and a lack of need. The second is the homogenization of Asians, which incorrectly views Asians as a monolith. Despite having different languages, cultures, religions, sociopolitical histories, socioeconomic statuses, and face very different challenges. Many are refugees and immigrants who have left their countries fleeing from extreme violence. Yet aggregated data about Asian American achievement typically lumps this diverse population together into a singular group, rendering their unique experiences invisible and underrepresenting their stories of poverty, racism, trauma, and disparity. Disaggregated data is critical in combating these myths and stereotypes. Next few slides are disaggregated data or common data displaying the differences between Asian ethnicities. The first is about limited English proficiency in race in Massachusetts by race. And of the 6.5 million persons in Massachusetts, if you look at the slide, 4.3 speak an Asian language at home, and 9.4 speak Spanish at home. These numbers don't exactly scream policy change or a revisit to best practices. However, if you look at the last column, what I did is compare within group differences. And thus, if you look at Asians, at the Asian language, those speaking Asian languages at home, 51% within the Asian population speak English less than very well. 42% within this who speak Spanish less than very well. This suggests that there is a significant number of LEP persons that are likely facing additional barriers to accessing services. This is something that we're going to discuss a little bit more about in some of the later slides. This second slide, similar to the first slide, but it disaggregates data on the Asian speaking populations. And if you look at the last column, what I've done is do within group comparisons among each ethnic group of the languages spoken by doing that, you highlight kind of the groups that are probably at most risk and the highest LEP speaking populations within those groups. And if you're going to notice, some of the more recognizable languages are Chinese and Vietnamese. However, some of the other languages that are not commonly showing up in translated materials or considered for translation or even considered when thinking about what type of providers speaking certain languages to hire. That includes Punjabi, that includes Japanese, Korean, and Khmer and Thai. The next two slides are tables from the Washington Center for Equitable Growth and disaggregate data in the Asian populations on education and income levels. For income levels, almost 50% of the Asian groups are listed under the US median. Only 4 groups have median incomes above all other AAPI groups. So this shows a wide range of disparity when thinking about different Asian ethnic groups in considering what their resources are, what their means are, and what barriers they may face when seeking services. The second highlights educational disparities among Asian ethnic groups, which shows another high degree of variability between different Asian groups, which also points out that grouping Asians together does a disservice in thinking about policy and practice within agencies and government systems. This last slide also assumes that low numbers may equal low need, which is another assumption when thinking about the Asian population. And this table, one of the tables in particular that I like to point out is the one in the center with the blue and the yellow colors, which is reporting severe IPV by ethnicity and suggests a significant underreporting by females when compared to the number of reports by male perpetrators of intimate partner violence. There are many reasons why population numbers are comparatively low. It may appear that they aren't seeking services. It is possible to think that low numbers actually equate to high risk. And I'll be talking about a little bit more about this throughout the presentation. So let me tell you a little bit about ATASK. ATASK is a culturally and linguistically specific organization that is designed to counterbalance inequities. ATASK clients are from 30 different countries, and we've plotted these on a map here that I'm displaying. They are all victims of violence. They are all immigrants and refugees. 95% are limited English proficient, requiring some form of translation and interpretation to access any services. They speak over 35 different Asian languages and dialects. Many are single parents with no stateside support and are often too ashamed to tell anybody that they're being abused, because in Asian culture, abuse is a family matter, and airing your dirty laundry brings shame to the family and to the community. They may not be involved in their children's academics, and this is not because they don't want to be involved, but because they can't communicate with the school and the school isn't communicating with them. They are at or below poverty levels and working. Most in the service industry where English proficiency isn't needed, but is likely also being exploited. They have a roof over their head, but living conditions are often subpar, and they're often being exploited by shady landlords. We serve over 120 victims and their children every year, and they do not fit the model minority. In fact, they're at higher risk due to the model minority stereotype, because policies and best practices aren't designed with them in mind. Asian victims of violence face major cultural and linguistic barriers. And stronger indicators, and maybe a strong indicator of why there are low numbers and underreporting. Some common cultural barriers include both patriarchal and collectivist values. Again, not airing their dirty laundry and bringing shame to the family and the community, and a strong fear of government authority. There's a lot of corruption that's happening back home in their own countries, which often can be a concern in thinking about reaching out to police, to courts, to talking about their status. They're not only afraid of being deported, but they're also afraid of their partner being deported. They're afraid of family members being deported. And under this current political climate right now, there's even a heightened fear. So a lot of times victims aren't reaching out to law enforcement for safety. And they're less concerned about, they're more concerned about being deported as opposed to the domestic violence. Other considerations are language-based marginalization. And because of the sheer diversity of Asian language, rarely is it possible to find advocates that speak their language, or even providers that speak their language. Most information materials and media are all English dominant. They can't learn about their rights, about their services, how to navigate US systems to identify help and safety, and are often being misinterpreted. And this results and can result in inappropriate treatment, intervention, and diagnosis. Translators, furthermore, translators don't always translate correctly. So a lot of these issues are concerns that make it harder for them to seek services that they deserve and need, and sometimes they give up altogether. Abusers also use language and culture as tools of power and control over their victims, which instills fear and prohibits help-seeking behaviors. And this slide will be in the PowerPoint that you'll be provided later on. So I want to talk a little bit about attempts to peel back some of the layers that that highlight the impact of COVID-19 on Asian victims of violence. And there are several. We start with our primary services. And our primary services at ATASK are twofold. One, to provide safety for victims and helping them to access safety, and then two, to provide stabilization once in our reaching out to our services to provide stabilization for clients. And so helping in safety means safety Providing safety means escaping an abusive environment, safety planning, providing shelter, legal protections, and educating on their rights. When we try to stabilize a client, what we're doing is helping to work with the client on establishing short and long-term goals, housing, sustaining income, English classes, children's stabilization, and addressing legal matters. This is compounded by basic characteristics of our clients that we mentioned before as being high risk, which is that they're often Asian immigrants and refugees. They're limited English proficient, they have limited incomes, and they have no social supports, and are dependent on clients, and have dependents. Over 70% of our clients are referred by English-only providers who recognize that they have limited English proficient skills, and they need to have a provider, such as an ATASK advocate, in order to bridge those barriers. The impact of COVID-19 has presented significant barriers to our staff and to our clients. Typically, an advocate, one of ATASK advocates, bridges linguistic and cultural barriers by being the central focal point of connection between multiple providers. And if you look at the slide right over here, you're going to see that the ATASK advocate is at the center in the relationship between providers and the client themselves. And at every one of these points, the bilingual or multilingual advocate provides interpretation and translation of documents, applications, and instructions for housing, public benefits, legal issues, child-related issues, healthcare, mental health, workforce and education, and even relations between police departments and DA's offices. When a client speaks an English language, this role will typically be reversed, where the client is actually the one that is working with every one of these providers, and the advocate is providing support behind them. This switch, when it is a limited English-speaking client, puts an immense amount of linguistic labor on that bilingual and multilingual provider. We go back on a slide right now. And so what this has done under COVID-19 is create an increased amount of stress on client services. Sorry, I'm going to move. Some of these high risk, those most high risk and impacted under COVID-19 fall into two categories. Those are those that are unsafe living situations, and they're living with their abuser currently, and those that are actually with ATASK services right now but are undocumented, have been destabilized because they're undocumented, and circumstances around loss of income and poverty. So of those that are living with their abusers, what we are noticing right now is that COVID-19 has shut down most of the services. So we're seeing a decrease in calls. And as clients have been able to reach out to us, what has been a problem is that we haven't been able to reach out back to them, because the opportunity is so small for them under physical and social confinement with abusers that they have to wait for that one moment where the abuser may leave the home, or that they can get out of the house to be able to make a brief phone call. And even if they're making that brief phone call, it makes it incredibly difficult to plan. Under normal circumstances, we would be able to figure out a plan and identify options for what to do next under these current in an abusive situations. Right now, we're unable to kind of plan and develop options that make a client living with an abuser comfortable enough to leave that abusive situation. And so what we are finding is that even in very high-risk situations, clients are opting to stay in the abusive relationship. And we've actually had clients that have actually returned to abusers because they have been weighing the options of whether or not it is safer in that abusive situation, or it's safer being in, say for example, a shelter under a residential shelter during COVID-19 and potentially contracting COVID-19. for undocumented clients. So if we're moving in thinking about undocumented clients, which is another high risk category, undocumented clients, which is another high risk category, their concerns are around the fact that they have lost their jobs and they don't know when they'll be able to return back to work. Their situation is a little bit more complicated because they don't have access to those benefits or those public benefits that are available to somebody who might be documented. And so in other words, what that means is that they don't have access to the housing subsidies. They're not going to get rental assistance or SNAP or food stamps or TFDC cash or emergency funding for elderly or disabled. They won't receive any of these funds, and they've lost their jobs. They may have children and they have no way of supporting their families. They're often in service industry jobs and are being exploited and don't know when they're going to be able to return to work. So in addition to this, part of being as an immigrant, they're often sending money back home to their families and unable to do that. And as a global pandemic, a lot of their families back home don't have access to the same resources that are possible in the United States. For example, even whether you're documented or undocumented, you can get tested and get treatment for free. That is not possible in other countries where they are having to front the money ahead of time in order to get tested or seek treatment. And in a lot of those countries, it is impossible for a person who may be symptomatic to be able to go and get these funds or seek treatment. For many of our clients who are at or below poverty levels, below poverty levels, they have also lost their jobs, don't know when they're returning, are working in service industry jobs and may be exploited. What their primary concerns are income and how they're going to be paying upcoming bills. They may be able to access public benefits. However, the moratorium on evictions is going to go away, and they're still going to have to pay their rent, and they don't have a reserve in order to cover the buildup of back rent or back payments. In addition to this, a lot of our clients don't, because of being limited in English proficient, don't have access to information on services, on benefits, on even where to go and find testing or to be tested, or what the process is. And so there's a lot of confusion and frustration and fear just around the lack of information that's been provided. We are aware that some government agencies are translating material. However, that material isn't getting disseminated back into the communities. And so there's a disconnect in what people are understanding and know right now. And so what's happening a lot of times is that LEP consumers or people are going back into their communities and may not be receiving accurate information. And so there are a lot of rumors that are happening right now, but they don't have a way to dispel those rumors. So ATASK, bi- and multilingual and bicultural staff are the key to serving a highly diverse Asian LEP population with significant service needs and access barriers. This is a picture of our staff, or some of our staff, and they are first-generation immigrants, refugees from 10 different countries, states, and regions in Asia. And this is just a snapshot of part of them. And for them, as providers and bilingual providers, COVID-19 has amplified systemic language-based marginalizations, increasing the linguistic labor expended by advocates, and not just our advocates, but anybody who is a bi or multilingual provider in the United States. There are the actual bridge to LEP clients or residents in the state of Massachusetts. Under normal circumstances, ATASK bilingual and bicultural staff bridge major cultural and linguistic gaps. We're a minority-led, minority-staffed and serving organization. We hire staff that match our population, and we serve the Pan-Asian population across the state of Massachusetts. 98% of our staff are Asian. The majority are direct service staff, first-generation immigrants, and refugees from, as I mentioned, 10 different countries and territory that provide firsthand insight into the immigrant and refugee experience and possess deep cultural understanding of political, cultural, historic events from our countries, our clients' countries of origin. For many of them, English is their second language, and that is very intentional in our hiring process because we want to make sure that our staff are able to fluently speak, read, and write the language that they are intending to serve, or the populations that they are intending to serve. We also promote generational diversity, which helps us to connect with clients given the hierarchical nature of Asian culture and clients' preferences. Some clients prefer to speak to an advocate who is older and them rather than younger than them, and some connect with somebody who might be younger. Most staff are native speakers, as I mentioned, that can read, write, and speak at their language at native levels. There are often better language speakers than some of the certified translators that we found in courts, or even medical translators, and collectively they speak 20 plus different Asian languages and dialects. This degree of diversity is highly intentional because research and data on the Asian population is sparse and often aggregated, offering limited information to the highly diverse nature of different Asian ethnicities to inform both policy and practice. ATASK counteracts the lack of information by looking inwards at the wealth of information imparted by clients, staff, trends analysis, programs, and cross-program discussions about barriers and solutions. We think very hard about what's going to make change and what type of changes that we need. Under the extreme circumstances of COVID-19, the majority of staff's time is not spent on DV-related issues, but on translation and interpretation, such as translating English-only documents and websites and interpreting over conference calls for English-only providers. Multilingual staff are trying to both learn and explain information about unemployment insurance, the moratorium on evictions, court notices, immigration issues, and COVID-19 updates that are predominantly in English, and then relay this information back to LEP clients. There is very little, if any, translated and disseminated information. Information is just not reaching LEP and immigrant communities. Clients don't understand the process and are lost, a loss of what to do or where to turn. They're unsure of who to call and worry about being able to communicate their questions and their concerns. This invisible burden placed on multilingual providers is overwhelming. They take on this linguistic labor because of the scarcity of translated materials and multilingual services. This invisible work often goes unrecognized and is never remunerated. As our population increases and diversifies, systems, policies, and best practices need to follow suit. In addition to the general fear around COVID-19, Asians face another fear due to the upsurge in racist and xenophobic attacks. We have several Zoom meetings where we meet with the staff, and you saw a picture of our staff. And during these meetings, I'm often asking staff focus group questions. And at one of these several meetings, I asked staff whether they themselves, their clients, people that they knew had experienced any racism and xenophobia, and these are the responses that I got. And most of them are listed right here, not all of them. And it's really disheartening to kind of see that this is what staff are also going with and the Asian community is dealing with. And I also, right now in the midst of COVID-19, so not only just fearing, the circumstances around COVID-19, but also dealing with racism and xenophobia from essentially the top down. And finally, I wanted to offer just a few recommendations and thinking about this. I'm really trying to be mindful of the time right now, and we'll quickly go through some of these recommendations. And so as we think about inclusivity and equity within Asian populations or any other marginalized group, out there, I think we could think about a couple of things. One, that's increasing accessibility. So to consult with providers who actually specialize and work with Asian victims of violence or other marginalized populations, to ensure that in our workplaces that there's representation, that if we're serving a marginalized population or minority population, that staff are of that same minority population, that they represent and understand that community or population. We can also work on enhancing best practices and policies by engaging in collaborative research that uplifts and raises some of the more unresearched issues on smaller populations, and learning how to access those populations, whether material needs to be translated, whether interpreters are brought in, whether we're engaging community-based participatory research where the community is a partner in that research with the academic institution. Another is to outreach marginalized populations in the service area, but be prepared that when you're doing that outreach, that you have representation in your workplace for that service seeker to reach out to and connect with, to translate, so in addition to translate material, and to advocate for policy change, to learn about what policies impact marginalized populations and communities that you serve in your region. Right now, the Safe Communities Act is out, and that's something to think about that supports immigrant communities and the safety of immigrant communities. And value lived and learned experience and language. There a shout out to all those bi and multilingual providers out there that are a vital part of service and service provision in any one of our systems. Finally, there are a couple of just resources that I find also helpful. One is the Asian Pacific Islander on gender-based violence. Another is some information on language justice. The Cambridge Police Department put out a safety planning tips, which were actually quite comprehensive and are great. JDI, two coalitions that I'd like to mention is JDI, which Muling already mentioned, which is Jane Doe Inc., and then the Mirror Coalition, the Massachusetts Immigrant and Refugees Coalition, which is another wonderful advocate for immigrants and refugees in Massachusetts. Thank you very much. And this is both Muling and my agency's contact information. And also, this is our contact information, both mine and Muling's. And these will both be on our PowerPoints that will go out later. Thank you, everybody, for listening.
Thank you, both Muling and Dawn, for sharing these amazing experiences and resources and information about how we can best support communities that have been affected by